Hi everybody, welcome to Caring for Our Community. My name is Steve Heider and glad to have you with us as we begin this endeavor. And this program, we should let you know, Caring for Our Community is a service of Child and Family Services of Newport County, and we're going to get right to it, and it's a great pleasure to get the ball rolling. Keith Tavares joins me. Keith, Vice President of Institutional Advancement at Child and Family Services. How are you?
I'm doing well, Steve. Thank you.
It's quite an undertaking. Let's tell the folks a little bit about what we're trying to accomplish with this program.
Sure. Well, we were fortunate enough to have the people at the local cable access program, PEG Access, come to us. Bob Panatowski, who's a terrific guy, local community guy, hosts Newport County in Focus, approached Child and Family, approached me and asked if we would be interested in hosting a local cable access program that really focused on the needs of our community. And we think, who better to do that than Child and Family.
People have heard the name Child and Family, but maybe a lot of folks don't really know the depth and the breadth of what the people there do.
Well, it's a great organization, a great social service provider. We've been around. We're the oldest and largest social service provider in Newport County. We've been in the community for over 140 years, right after the Civil War. Started as an orphanage and has grown into probably one of the most comprehensive social service agencies in the state of Rhode Island. We do everything from child care all the way up through working with children, working with teens, working in the school systems, working with elders in the community. So it's a constant flow of service and just really looking out for our neighbors and making sure that the people in our community are comfortable and get what they need in order to live a very comfortable life, or a comfortable life, I should say.
I think it's great when you put it that way, looking out for our neighbors and trying to help make Newport County just a little bit nicer place. What are, Keith, some of the biggest challenges that face you on a daily basis?
Well, we're going to be hearing a lot from different people on this show, and you're going to, over the rest of the program tonight, and also over the next few months, you're going to hear from different people, and they're going to be sharing their stories with you and what they see out in the community, and also the services that they provide. But this economy has really impacted Rhode Island hard, and a lot of people think Newport County, there's a lot of wealth there, and it's a stereotype, and it's not true. We're the third most poverty-stricken community in the state of Rhode Island, behind Providence and Woonsocket. And that says a lot about our community. We do a very, very good job of caring for one another. So you don't see it. It's not as prevalent, but it's there. And we're seeing it. And I think you're going to hear from some great people who have a lot of good impact on the community, but who are seeing some people facing some hard times.
Keith, how long has Child and Family been around? How did it evolve into the organization that it is today?
It started exactly as what I was just talking about, people caring for one another, neighbors looking out for one another. Right after the Civil War, a group of well-off women noticed an increase of children in the streets of downtown Newport begging, panhandling. And they came together and they said, we've got to do something about this. And they created, it's an awful name, but it was what it was at the time, the Home for Friendless Children. It was Newport's orphanage. And it was the first social service agency or social service entity in Newport. And that organization grew very quickly over time, through the Depression into the 20th century. It stayed a very, very strong, stable orphanage with some great people running it, community members coming in and supporting it with farm product. You had people that were sewing clothing for the children. It really was a great organization. And then, of course, orphanages went by the wayside in the 1960s, and the state started to take a larger role, and Child and Family became much more than just an orphanage. They became a provider of things from family support services, elder care services, child care. It really became a very comprehensive social service provider, and the one that it is today.
Not trying to be funny, but if you took it literally, was it the Home for Friendless Children? I could have benefited from that as a young guy, I mean, but luckily not an orphan, but you know.
Yeah.
Well, a little bit later on in the show, we're going to talk about school-based services and elder care, but what are some of the other, you talk about the job you do with kids. If you could get a little bit more into detail with that and what you're trying to do, because I think maybe the conception, at least my conception was maybe, you know, children who are in need of foster care, that type of thing, that's one of the services provided?
Foster care, no. We have foster care in our network of service providers. We provide homes for children and teens that are removed from their homes for any number of reasons. It could be abuse, neglect, could be financial situation, you name it. It happens. We have approximately 12 homes on Aquidneck Island that provide support to children and teens from not just Newport County, but from across the state of Rhode Island. We also have our Sandpipers Early Learning Center, which is a state-of-the-art child care center. We have some great kids in that program. Every child we have from infancy to preschool age. We have a family counseling center, which works with families on any number of issues, including substance abuse. You're going to hear about our family support services through community-based and school-based programs. You'll hear that we have staff in each one of our public schools on Aquidneck Island, in each one of our public school systems, I should say. And then, of course, we have elder services for elders living in the community. That's a very, very important part of what we do because of our population on Aquidneck Island and in Newport County. We also have a supportive housing program for homeless mothers with children in Newport Heights. I'm sure I'm missing something, but we do a lot. We do a great deal.
We're going to have a chance to talk about specific programs throughout the course of this show. Yeah. One of the things that I'm sure you have to do in order to get funding and that type of thing, the results. I would have to imagine that the numbers, that the results are remarkable for those children who are able to benefit from Child and Family.
They are. And one of the better programs that has incredible results is our Rhode Island Care Management Network. It's the residential program that works with children as well as families. And you'll hear about that probably in a month or two. We're going to have a guest on that will talk about that program. In fact, the state is moving in the direction of what Child and Family already does in residential services and in family support services. And they're doing that because we've done it so well, because our results are true. And they really do have a very positive impact on children, teens, and families. One of the things I want to say about this program is that we're also going to be bringing in, for you to interview, other entities of Newport County. I'm hoping to bring in community leaders and people that are running other social service organizations and other programs that have positive impact on Newport County. You know, I foresee, you know, the Martin Luther King Center and Lucy's Hearth and, you know, the Edward King Center, and having them involved as well.
Well, and to that end, folks may wonder what's Heider doing on this show. I am primarily a sports guy. I've been the voice of the Pawtucket Red Sox for the last 8 seasons and have worked in that business for the last 25 years or so. But I'm a Newport guy. I was born here, I was raised here, graduated from Rogers High School. And if there's some way, the name of the show, Caring for Our Community, if there's some way that I can help and in some small way give back to the community that's been so good to me, that answers that question, and that's you know, that's why I'm really thrilled and honored that you folks have asked me to come on and be the host.
Well, we're incredibly grateful. Thank you very much for doing it.
Well, Keith, I think we're off to a good start. We're going to take our first time out. If folks would like to get in touch with you and find out more about Child and Family, how would they do that?
They just give me a ring. I'm at 401-848-4150. And they can reach me at Child and Family anytime during the week. And I think our website is going to be on the screen, but it is childandfamilyri.com.
All right, well, thank you, my friend. When we come back after this break, Ramona Mello will join us. Ramona is the Director of Community and School-Based Services for Child and Family. So stick with us. This is Caring for Our Community, and we'll be right back. Welcome back to Caring for Our Community. My name is Steve Heider, and glad to have you with us on our first program. Thanks to Keith Tavares for being our first guest. We got the ball rolling, and now it's a pleasure to be joined by Ramona Mello. Ramona, you're the Director of Community and School-Based Services at Child and Family.
I am.
First off, welcome to the show.
Thank you.
And tell me what that position entails.
Well, I we have community-based programs and school-based programs that fall under my direction. In the school-based programs, we have serve Middletown schools, Newport schools, and the Portsmouth schools districts. Our community-based services serve Newport County as well as the Upper East Bay.
All right, well, let's talk about the school-based services first.
Sure.
What's the biggest thrust, your main focus?
We have a couple of different programs, but the largest of our programs is our Student Assistance Counselor program. Those programs are currently in all 3 of the school districts, and our intention there is to provide some substance abuse prevention educational services to junior high and high school kids. At the junior high level, there is they do a lot of school-wide initiatives, such as anybody who has kids who are in a junior high have probably heard things like Red Ribbon Week, Kick Butts Day. There are different activities that get kind of the whole school involved in the process of thinking about substances and being substance-free, living a substance-free life. At the high school level, they do a lot more of, the focus is, they do some school-wide endeavors, but also they do some, like the post-prom parties, things like that, initiatives that would really look to find activities for kids to do that don't involve substances. There's also a portion of kids who can come down and see the counselors on an individualized basis. Sometimes they come, if they have concerns about a friend who might be in a situation that they're concerned about, kids come down self-refer. At the point where somebody is just talking about, they have some things going on, the student assistance counselor can be there to support them in the school. If it seems like they're getting kind of a little over their head with things, then they might be encouraging them to contact their families and get in touch with, some trusted adults who can help them out with some of the troubles that they're having.
So we're talking about not necessarily just drugs, we're talking about tobacco, talking about alcohol. How prevalent is the usage of those things with kids today?
I think when looking at all of those things all combined and all together, it's fairly high. But I also think that the perception is higher than it really is. And I think one of the things that they really try to do is look at that kind of perception of harm kinds of things and how many kids really are going out and drinking excessively on the weekends. And what happens is when you ask students how many of their classmates do they think are participating in these activities, what you learn is they think it's a lot more than it really is. Mm-hmm. So, however, it is certainly an issue that I think it has always been a concern for communities, but it's something that it's interesting once you look at that data in that way and you see, the perception of it sometimes doesn't really match the reality.
So I guess a lot of it, what you're trying to do in the education part is helping the kids to make better choices.
Absolutely, absolutely. Learning those skills to say no or to recognize that, maybe it's really not all it's cracked up to be. Maybe, these are just stories and I don't need to get involved.
Right, it's not always the easiest thing to do to be able to, shun the peer pressure.
Right, yep. And so we also, one of the things we do at the high school is also work with the Students Against Destructive Decisions group, which is the SAD group. And that's really all about kind of getting a group of kids together who are really interested in kind of having some impact on their school and impact on that community in a way that, helps kids to know that it's okay, to not participate in those activities.
I asked Keith before about results, and I guess it's kind of hard to quantify, though, how you, if you're keeping kids off cigarettes, off pot, off beer, or whatever else there is.
It is actually, and it's interesting because we're currently, I think, from a statewide level, right now we're at a place where money is clearly short across the board. Federal money, grant money, everybody wants to know that what they're paying for is actually making a difference. On a statewide level, the Student Assistance Counselor program is looking to develop a logic model and looking for outcome measures so that we can show that we are effective. Our program is great, and we are island-wide, but statewide there's a lot of Student Assistance Counselor programs. So really we come together to try and and develop measurement tools so that we can show our effectiveness.
I would imagine that might be almost as big a challenge as trying to keep the kids clean.
Yeah, absolutely.
Yeah.
Yep.
Let's talk a little bit about the community-based services, what Child and Family does, and what services you provide families throughout Newport County.
Our community-based services are provided on a large scale to families at this moment, the way we're currently structured, on a large scale to families who are involved with the Department of Children, Youth, and Families, DCYF, in the state. So these are families who may have had difficulties either maintaining children's behavior in the home based on just, you know, all sorts of different aspects of their environment, their home environment. So we go in, we help families. We're very caregiver focused. We're very strength based. We really kind of try to help families we know that they all are doing things well, and we know that they all have strengths. And we really work to help them to really build on those strengths and utilize them to help them with the things that maybe they're struggling with right now. So we help them to try and identify who their natural supports are, who they can utilize for, you know, different things that they have going on and different, you know, struggles that they're having. We take a teach a man to fish sort of philosophy.
Sure.
We're not all about, you know, helping a family, like just doing something for a family. Transportation is one of a large barrier that our families run into. And so it would be so easy to take a family to a doctor's appointment, chuck them in our car, go on to the doctor's appointment, but we really try to help families to utilize what's available to them and help them to gain the skills to be able to, we want no part of being involved in a family's life forever. So if we can teach them how to utilize public transportation, how do you use the bus system, how do you get from your house to the doctor, how do you get back? That might mean that rather than putting them in a car with us and taking them, we might ride the bus with them and get them there and then get them home so that the next time they need the appointment, they can do it on their own.
Things that a lot of folks may just take for granted.
Absolutely, yeah.
And I would think in tough economic times as we're in right now, that money is part of it. I would think that's part of it. What are some of the other challenges that families face and maybe more of like what you were already describing?
A lot of our families struggle. Right now, housing is a big concern for a lot of our families, whether it's adequate housing that, you know, families in some regards are needing to kind of pool their resources and move in together, but there's not enough space in the homes that they're in. So I think housing right now is a really big struggle for a lot of our families. Comes down to finances. A lot of times the kids that we work with, the kids who are in those families, one of the things, a lot of them have difficulties at school. And so one of the things that we really try to work on with them is trying to get some positive social activities, recreational activities in the community. For some of these kids, school is their only social activity, and it's not always a positive thing for them. So they have this like negative social piece in their life, and there's really not that positive place for them to flourish and grow. And we've had opportunities this past year. The Newport Art Museum does an Adopt an Artist program, and we were offered scholarships. And we got some of those scholarships for some of our kids, and it was just really great for these kids who, in school, you know, whatever, they're not doing so great, they're having difficulties, but they're really flourishing in this artist program because it's something that they really enjoy, they're good at, they're getting positive feedback. So it's kind of nice to be able to find those activities. Not easy, because again, it comes back to finances.
Sure.
So it's really, that part of it can be a little difficult, but when we can find them, we'd love to try and get our kids involved in stuff that they're interested in.
Before I let you go, how can people help?
Oh, that's a
Our
great
viewers,
question.
I mean, if there's somebody, we're still a couple of months away from the holidays, and I think
Yep.
people want to help at that time of year, but you need help 12 months a year.
Absolutely. I think about that all the time. People always want to help at the holidays, but kids have like birthdays year round. So there's always things happening, and it's back to school clothes, back to school, you know, products, whatever. But I would say in terms of like recreational activities, if anybody has any knowledge of programs that are either inexpensive or free to the community members, if they could let us know what those are, or if anybody is interested in trying to partner or come up with something for kids on after school, weekends, whatever, that would be great to be able to get involved.
Or they could call you and brainstorm. How would they get
Absolutely.
in touch with you?
My phone number at Child and Family is area code, of course, 401-845-8921, and that's my direct line.
Ramona, thanks so much for being with us, and congratulations on the great job that you do.
Thank you very much.
That's Ramona Mello. She is the Director of Community and School-Based Services at Child and Family. We're going to take a break. When we come back, Carolyn Malloy will join us as we continue with caring for our community. Welcome back to Caring for Our Community. My name is Steve Heider. Glad to have you with us. This program, our maiden voyage, if you will, first time out. And we're going to try to do this for you every month, and we appreciate you tuning in today. The show is brought to you by Child and Family Services in Newport County, and it is now my pleasure to welcome Caroline Malloy to the show. Caroline, you are an elder specialist with Elder Services Specialist.
Yes, I
My
am.
apologies. What does that mean?
Well, that means basically that I'm a case manager, and that I go out and I go to the homes, and the most important thing I do is that I assess people in their homes to see their needs.
In terms of
In
safe
terms
living
of-
conditions?
Exactly. A typical day would be that I would get a call from maybe a daughter of an elder. She might be a little concerned because the elder is somewhat forgetful. They feel like maybe they need a little bit more help in the home. I will make an appointment to meet with the elder and the daughter right in the elder's home. I want to be in the environment that the elder lives in, to look around and just see what the needs are, see if there's food in the refrigerator, see if maybe the home needs cleaning. And then I will talk with the elder and see where the elder's at, what that person really wants, and what the daughter has in mind. We'll all get together and we'll decide on a case plan. And I might make a recommendation, and one might be for home care, to take care of the cleaning, the meal preparation, the groceries. At Child and Family, we have a licensed home care agency, and we have certified home health aides and homemakers. They're able to go out and assist with personal care and things like cleaning and laundry, things like that, just your basic needs to keep the elder safe in the home. And the goal of all of our programs at Elder Services is to keep the elder safe, independent in their own home for as long as possible, and improve their quality of life in the home. And I think that's what mostly every elder wants, and their families too.
You brought up an interesting point, keeping them independent. I would imagine that a lot of folks, the elders, want to maintain that independence.
Absolutely.
Do you find that a lot of times they're resistant, or most of the time are they really willing to take that helping hand?
A lot of the times they do, they're so glad when they find what we have to offer. And like with this family that I said I was talking with, I had a referral made for information and referral for that person, because we have a plethora of all different kinds of services, and we can help with housing options, we can help with senior discounts. I think when the elders realize that we're there and we really want to help them, and we have so much that we can help them with, that they are very welcoming to have met us and to take our services.
Now, do you provide just the assessment, or does Child and Family actually do or perform the service?
We can provide all the services. Like the home care, we have a home care agency right in our Child and Family department. We have home care. We have the information and referral specialist. We have volunteers. And actually we need volunteers. And we match our volunteers with an elder. The backgrounds could be the same, like we matched 2 teachers recently, 2 military people. We match them with different interests, sports, you know, whatever they'd like to talk about. Just an hour a day visiting, world of difference for these people. It's big. That might be the only person that comes in to see them. So that's really important.
What are, yeah, I would imagine loneliness would be a big factor.
It is.
What are some of the more, along with that, more prevalent needs of the elderly?
Well, we have a counseling program. And as you know, I mean, as you get older, there are losses that occur. And they can be anything from, you know, you're losing your friends, you're losing your spouses, you're losing your eyesight, maybe you can no longer drive. And so many elders can't come into our counseling program, and we have this great service where an elder can have a counselor come to their homes and help them in their homes. And that's something else that we're very proud of being able to offer.
What I would imagine there's no such thing as a typical visit, but on a day-to-day basis, is there initially resistance, or as you said before, are they just kind of happy that someone cares?
Yes, sometimes there is, but like I said, once we explain what we have to offer. Another program that we have that I wanted to mention too is a victim of crime program, and it's for elders who, by the way, our program is anyone over the age of 60 is an elder, so we serve 60 through 100. We have a collaboration with the local police departments. Whenever an elder has been the victim of a crime, we will actually go out into the homes with the police officers, and we will provide support. We will refer to our wonderful counseling program, our wonderful services, to just get them back up on their feet, go through the trauma of the crime, you know, just try to support them and prevent the crime from happening again.
I was going to ask you if you have a lot of inquiries from family members of the local elders, or do they will they ever take it upon themselves to say that maybe it's time I get some help?
Family members call all the time. We also get self-referrals from clients. We get referrals from all the agencies locally. We get referrals from neighbors, from other family members, from doctors. Anyone that might have a concern about an elder will call us, and we'll go out and we'll do the initial assessment to see what the needs are.
And when you do that, are there other organizations that you work hand in hand with, or is this kind of like a one?
No, we work with all the agencies in Newport County, as well as we provide services at Child and Families Elder Program as well.
How rewarding is it for you to see the results when people have their lives made just a little bit easier or better?
It's great. I mean, I think that's why I do it. You feel like you've done a good day's work, and you feel like you've made the difference in somebody's life.
What are some of the other things that we should know about elder services? How people can help, or what the, you know, because a lot of times, unfortunately, I would think that the elderly are somewhat neglected if they don't have immediate family in the area.
Absolutely, and there's a wonderful program. It's one of our newest programs. It's called Living Well in Newport. It's a concierge service. It's a safety net of services, and it's actually a membership program. It's $1 a day, or $365 a year, and for that amount you get vetted services. So we have a whole list of providers for anything from, if you need a plumber right away, if you need a hairdresser that will come to the home, if you need someone to shovel your walk or do your yard work, I can provide a service right away. Somebody can come right out, and we know that they're going to be on time, that they're reliable, that they do a good job, and they will have a discount on their services. That also provides social activities and educational opportunities. It's really a great program.
Are you looking for volunteers? Are you looking for people who can in some way help?
Absolutely. I need volunteers for the Living Well in Newport program, and I definitely need that volunteer visitor. Just sit with the elder for an hour. You are going to be signing up because you think you're going to help the elders. Guess what? They're going to be helping you.
You're going to feel better.
You're going to feel like you are helped by
And
them.
how can people get in touch with you, Caroline?
It's 849-2300 is our main number, and whoever is there will take the call.
Thank you so much for being with us and for the great work that you do.
My pleasure.
Really appreciate it.
Thank you.
That is going to do it for today's edition of Caring for Our Community. I want to thank Keith Tavares for being with us, Ramona Mello, and of course Caroline Malloy. My name is Steve Heider, and appreciate you watching. And let's get together again real soon.